Good day. I'm Jeanne Conry. I'm past president of the American College of Obstetricians and Gynecologists and chair for the Women's Preventive Services Initiative.
Hi, I'm Sue Kendig, Director of Policy for the National Association of Nurse Practitioners in Women's Health and a member of the Women's Preventive Services Initiative Advisory Panel.
And today we're going to introduce you to the Women's Preventive Services Initiative, Preventive Care for Every Woman, Every Time. And looking forward to all of you really investing in the health and well-being of women around the globe. We have no conflicts of interest. I'm just going to give you a little bit of a historical perspective, because with the introduction of the Affordable Care Act in 2010, private non-godfathered health plans are required to cover a range of preventive services for women with no cost sharing. It does not include Medicare and Medicaid, although we found almost 75% of individual states have made recommendations to expand and to strengthen Medicaid. The ACA based their decisions regarding preventive health on the United States Preventive Services Task Force, the Advisory Committee on Immunization Practices, the Health Resources and Services Administration's Bright Futures Project for Children, and HRSA, former Institute of Medicine Committee on Women's Clinical Preventive Services. Now, recognizing that recommendations will need to be assessed and updated, HRSA in 2016 introduced a 5-year agreement known as Women's Preventive Services Initiative. We have 2 overarching goals. 1, to update preventive health strategies and recommendations, and 2, to develop implementation strategies. You are essential in any of these implementation strategies. Now, you might ask, why WPSI? Why Women's Preventive Service Initiative? There are gaps in coverage and gaps in preventive care for average risk women. There are many agencies and, in fact, many medical organizations and specialty groups that make recommendations around women's health. They may be disease or population specific. They may be complex, unclear, and difficult to implement. The fact is, we lack consistency. Clinicians may be confused, and patients certainly can become confused. And there are disparities in screening across racial, ethnic minorities, lower health literacy individuals, and the poor. So our goal is to identify the research gaps, provide consistency across all medical organizations that are providing care for women, and avoid any duplication with U.S. Preventive Services Task Force, AAP, and the CDC. The care women receive should not reflect the bias or prejudice of any clinician, but rather should reflect what we call the collective wisdom of what provides the best preventive health care and health screening for women. Now, just to briefly overview our methodology, we consider the best available research and address the topics that are recommended by clinicians and lay public alike. We recognize that there are gaps in research, particularly around racial and ethnic minorities. We're fortunate to partner with physician scientists, and in order to provide a transparent process and rigorous research review, we have that information on our website. The Pacific Northwest Evidence-Based Practice Center, EPC is our acronym, at the Oregon Health and Science University, oversees the search strategy, our study selection, our evidence analysis, and our summary. They present all of that information to the Multidisciplinary Steering Committee and create a recommendation. Our goal is to minimize the impact of individual bias and conflicts of interest. Next slide. There are 2 components to every recommendation. The first is a summary of our overarching recommendation. Next slide. And the second I call the clinical caveats, considerations and areas of future research that we identified in our review. Next slide. In the first year, we covered all of the Institute of Medicine recommendations. Next slide. In our second year, we covered diabetes mellitus after pregnancy and urinary incontinence. And then in 2019, we covered screening for anxiety.
Next, I'm going to walk you through some of the resources available through the Women's Preventive Services Initiative, starting with our shining star, The Well Woman Chart. The Well Woman Chart was released in 2018 and updated in 2020 to include our latest anxiety recommendation. And the chart is a comprehensive tool that summarizes the preventive services recommendations for women from the Women's Preventive Services Initiative, the U.S. Preventive Services Task Force A and B recommendations, and Bright Futures. And they are age stratified to provide guidance as to when these should be included in the Well Woman visit. There's also a clinical summary table that accompanies the chart that includes clinical practice considerations as well as risk assessment methods, age and frequency to deliver services, and so forth. So let's take a look at what this all looks like. This is an example of the Well Woman chart, and as you can see, the dark circles indicate that this is a service that should be available to all women in the age group that it's indicating. The circles that aren't filled in indicate a recommended service that has special considerations, so maybe for only a special subgroup of that population. Next slide. Looking at the clinical summary tables, these are really helpful. As you can see, they provide an overview, they provide the actual WPSI recommendations. So in this case, screening for anxiety in adolescent and adult women aged 13 and older, and provides the rationale for that recommendation, as well as some considerations for screening within clinical practice, as well as some of the rationale for the recommendation. We also have frequently asked questions around the Well Woman chart, so guidance that can help, for instance, in describing what is the Well Woman visit. Does it take place in one visit, or can all of these services happen over time? There is also a new frequently asked questions document around telehealth, because during this time of high stress where people have not had access to the healthcare provider for preventive services as much as they would like, preventive services can also be offered over telehealth. And some of the recommendations, such as the screening for anxiety recommendation, intimate partner violence screening, and so forth, may be particularly pertinent at this point where women may not be accessing their support systems and healthcare providers as often as they would. So while some, such as cervical cancer screening, aren't available via telehealth, certainly many of the preventive services lend themselves very well to telehealth. And hot off the presses is our coding guide. So something that can provide guidance for all of the WPSI recommendations in terms of coding, as well as some of the explanations of some of the nuances around Medicare and Medicaid reimbursement for preventive services. We also have a fabulous patient trifold that provides information about the WPSI recommendations, as well as the importance of preventive services to women's health, so that women are well equipped to talk with their healthcare provider about the care that they need and deserve during that Well Woman visit. And finally, we want you to get involved with us. We need you to keep WPSI at the forefront. So download the recommendations, the Well Woman chart. Make sure that your friends, your family, your patients, your colleagues all have copies of that Well Woman chart. You can request free hard copies from our website. I'd invite you to download the additional resources that we talked about, the frequently asked questions, both around the Well Woman visit and around telehealth and preventive services. Participate in our public comment opportunities. There are opportunities as we are considering new topics, and there are opportunities after a recommendation has been made. If you join our listserv, you can receive notification of that, and just keep in touch with the WPSI website so that you know when those opportunities are available. And importantly, think about what women need in preventive care and nominate new topics if they aren't already there. And please feel free to reach out to our WPSI staff if you have any questions or need help in accessing the resources.
We want to thank everybody. Thank you to Michelle Jones for coordinating all of these events for us. And thank you to our many colleagues in the Women's Preventive Services Initiative. Remember, every woman, every time.